Hi everyone, this is Dr. Tamara and today I am very much excited for making this video because this is absolutely an special and additional part of my given last two videos on the book review on the CARCINOSIN Drug Picture by D.M.Foubister. And this additional portion I could able to add by getting amazing idea from a great teacher. My teacher, I'm blessed to get his direct blessings, Dr. Naveen Kumar Singh sir, who is currently lecturer of the department Case Taking and Repertory CHMC. Sir gave a great idea that I should describe some points from this book where repeatedly used clinical points and which will really and amazingly help us for diagnosing as well as prescribing carcinosin. So thank you sir, and without wasting time, everybody watch till end to know the gems and special points and what actually we should understand about the drug. So move for the explanation of some important additional points which is given repeatedly throughout the book, and I am going to explain mainly three important words repeatedly used all over the book. Before going towards the points descriptions, I'd like to mention about the name of prover whose additional adding and proving symptoms gave immense value and symptoms throughout the carcinosin drug, that is Dr. W. Les Templeton, who along with Dr. Foubister proved the medicine. Initially it is written that the origin of the medicine is unknown, but later parts it's written that probably it's from carcinoma of the breast. In my part 2 video, I have described about other site and locations and along with which name is coming for this site of carcinosin medicine. Alright, so now moving to the discussion part, first I am coming to the word blue sclerotics. Yeah, blue sclerotic appearance is written many times throughout the book. So what does it mean? With the medical students from blue sclerotic, we can understand that sclera. Yeah, sclera means white part of the eye. So it's the white part becoming blue. So the opaque fibrous protective outer layer of the eye containing which is collagen and elastic fiber, it's becoming blue. The reason? It's because of some medical conditions which you can remember easily through this mnemonics, hopes, belief. I hope it will be useful to remind that why blue eye can happen. So hopes belief denotes H for high myopia. So suffering from myopia and becoming more refractive error and power can have a chance for blue eye. Osteogenesis imperfecta. Then pseudoxanthoma elasticum, Ehlers-Danlos syndrome, scleritis, and belief for ophthalmos. So these are the usual medical conditions making the blue eye. So from this disease knowledge, we can understand and correlate that carcinosin drug would help in such situations if the symptom corresponds and will get good result. All right, moving to the next topic on points, I want to highlight that the appearance of cafe late appearance. In my previous videos, I have told that cafe late means exactly came from coffee in the milk. So milk and coffee mixing, so it is giving the color of light brown. Exactly appearance looks like that, and sometimes it's taken as birthmark, and usually we see it very commonly. This all pictures totally downloaded, not from OPDs, but we see OPDs day to day. It's patient comes with this cafe late spots and appearance, but usually it is related to some diseases too. For so diagnostic purpose along with for prescribing carcinosin, of course this is a great indicating point. So cafe late appearance, another pictures in different locations given in this slide. The pictures I have highlighted so that clinically you can diagnose it easily. Now coming to the reasons, the causes. What are the pathological conditions? Disorders like in MCQs, we know that neurofibromatosis 1 is one of the most prominent, and appearance of cafe late spot is found. Others are McCune-Albright syndrome, Russell-Silver syndrome, multiple lentigens, ataxia telangiectasia, Fanconi anemia, very well known, tuberous sclerosis, Bloom syndrome, epidermal nevus syndrome, Gaucher's disease, and Chediak-Higashi syndrome. These all syndrome and disease conditions would be better if described one by one, but due to short time, I'm going to describe one or two diseases, and in future, I hope for medicine part, when I'll make video, I'll go through details of each and every symptoms. Along with this spot will remind in mind. All right. So neurofibromatosis 1, before going to that, a little bit statements about caffeine spot, that it's hyperpigmented lesion that may vary in color, just I told, light brown to dark brown, and exactly it's coffee in the milk, just right side the picture came exactly this type of appearance. And what is the reason behind this? We know that there is the melanin that represents the color of our skin, and here the increase in melanin content making caffeine spot. So the conditions I described before, so moving fast, other solitary caffeine spots that can be seen in newborns around 0.3% to 18%. It is usually benign and produce no mortality or morbidity. All right. So neurofibromatosis 1, I'm describing little bit because it's very important and prevalently seen, and most prevalent one, and it affects multi-system, and it's a genetic disorder. Here, what will be the pathological impressions? The cutaneous finding most notably seen caffeine spot along with axillary freckling, and there will be skeletal dysplasia. Growth of the bone, benign and malignant neoplasia of the systems, and most notably benign neurofibromas. So spots seen in the skin along with neurofibroma of the body can clinically diagnose neurofibromatosis 1. In latter picture, I have given it for your clear understanding, that in above picture is the caffeine appearance in the skin, and below pictures, these are the neurofibroma present. All right. So for diagnosing this neurofibromatosis 1, you can think of this approach. These 7 points are very important. First of all, 6 or more caffeine macules, that is over 5 mm in diameter, and 15 mm of diameter. Don't be confused, just be clear. Divide it in prepubertal and postpubertal portion. If prepubertal, then it will be over 5 mm in diameter, but in postpubertal, that will be 15 mm in diameter. Clear? Next, axillary or inguinal freckling is seen, and 2 or more iris leaf nodules. Yeah, you students who are doing MCQ know that this comes repeatedly, leaf nodule is found in. And neurofibromatosis is one of the characteristic for diagnosing this disease. All right. 2 or more neurofibroma or one plexiform neurofibroma in the adolescence or pregnancy state can be found. Other points like it's affecting the multi-system, so long bones, there the cortical thinning is seen, and sphenoid dysplasia also found. Optic gliomas is found there along with first degree relative with necrotic factor 1. Moving on. Other manifestations like there can be seen learning disability. A patient is coming with telling that I can't do good in my maths, or I can't adopt some skill, any type of new skill, learning ability is poor. So this can be seen related to this pathological state too. Seizures is very common symptoms and seen. Precocious puberty, that is absolutely the very much common to the McCune-Albright syndrome. I'm moving on next slide. So precocious puberty can be found along with malignant neoplasia, that is around 3%. Malignant peripheral nerve sheath tumor is found there. Pheochromocytomas, rhabdomyosarcoma, leukemia, and Wilm tumors. And don't forget, hypertension is very much related to this disease too. All right. Now, McCune-Albright syndrome, in short view, I'm telling this, the triad we know that precocious puberty, cystic changes in the bones, and capillate patches of the skin. These three triad is giving the diagnosis of McCune-Albright syndrome. That is absolutely because of the hyperproductions of and autoproductions of estrogen from ovary, where your FSH and LH level will be low, and the typical appearance on the left side picture you can see. This is the picture for McCune-Albright syndrome showing, and mainly it is more prevalent in girls because ovary is producing extra estrogen. All right. Now this one, I hope from picture you can clinically diagnose it very well, that it's nothing other than numerous mole, which word is repeatedly used on the book. So in the appearance in single line, this 3 point is given, that is blue sclerotic, cafe-late appearance, and numerous mole. The medical terms of numerous mole is melanocytic nevus is used. So this one, this moles usually talking about this is it's common and usually smaller than 5 millimeter in wide. So and oval in shape, sometimes surface is usually smooth. Okay. People with dark skin or hair that have darker moles than the people of fair skin or blonde hairs. And as the year passes, we see that moles usually changes and slowly becomes, sometimes it becomes raised and changing color, while it may disappear also over time. But usually there are two types. I'll go on next slide, that congenital one usually remains and do not do much more harm, but sometimes the hair also develop over the moles. So if you go for the reason why this mole happens, moles are nothing other than the melanocytes in the skin grows in cluster form. Rather than spreading throughout the skin, it is congested and centralized on a single portion and clustered form. That's why mole is forming. Other reasons like sun exposure in the childhood can be the increased number of moles. Moles darkens during teenage due to hormonal changes and pregnancy too. Irregular moles may develop into skin towards cancer, that is melanoma. I'll go for that. Okay. So congenital lymphoid, usually it's a smooth one, and usually it do not do harm, like symptoms of itching, any kind of rashes or secretions do not find here. So that the type where you will find the difficulty, that is dysplastic nevi, that is medically termed after 1992 as atypical mole, which is sometimes cancerous and it can cause the problematic. So your medicine can be applicable for both of these types and moles, but usually you will get good result with this atypical one, na? Because which is making problem will make a solution. All right. So this was the overview of this 3 point cafe-late spots on the left hand of the picture slide, right side moles, and the left side lower portions of the picture is blue sclerotics. So I hope through these slides little bit you could able to gain some ideas and knowledge about these 3 points, which you will be able to clinically diagnose it and apply the amazing medicine carcinosin. And I will never forget this appearance is typically showing absolutely the this type of diseases along with indicating this medicine. References are used from Nelson textbook of pediatrics along with Google Baba helped me a lot, and Medscape I information took from. So thank you everyone, keep smiling, stay healthy. Thanks for watching.